I became involved because I had a patient story to tell about my husband who had been hospitalized. Not satisfied with the care, which we obviously rectified later on. But in the meantime, I felt I had to get back to the hospital to let them know what to say. I procrastinated, and finally there was an ad in the paper, and I said, I've got to do this. I applied and was interviewed, accepted on the committee, and here I am. They needed to treat the patient as an individual. We come from a medical background at that point where people were treated by their diagnosis. So you came in for a gallbladder, you had your surgery, you went home. And if you were 96 and going home after surgery, it didn't matter. You just went home, the surgery was over. But what happens nowadays, what people needed, especially the senior population, is help with how to care for themselves, to look at the whole person. What were their needs when they came into hospital, and what were their needs as they left? So there had to be transportation across the systems. There was none of that at that point, at least not that I had experienced. It was very new territory for the hospital, and we were received very warmly as a committee, but then we had to introduce ourselves to everyone else within the hospital environment. That took a little bit of time, and we have succeeded in that. We have come a long way where we have advisors on hospital committees, we are on medical committees, and we are being asked to join into policy making and other things. It's a slow process, but one of our goals was to change the culture of the hospital, and that is slowly going forward. We need to broaden that perspective into the community. We need to have our patients flow from the community into the hospital, back into the community. That's a large goal, and we're going to have to do that through baby steps. We've started that we have involvement with pharmacies that follow patient medications through. The paramedics now visit seniors who are post-discharge. So we're accomplishing them in many steps, but we have a long way to go. I would ask the potential patient advisor to think about why he wants to be that, because you cannot come in with a chip on your shoulder. That never works, because you have then one goal that you have in mind, and it's your goal, not the goal of the patients as a whole. So they must come in with an open mind. They must want to give some of their time, and personally, my time was selective. I was able to say when I was available, what I wanted to work on, etc. So they need to know that when they commit, it's not 100% of their time. It's volunteer time, and they can pick and choose some of the things that they want to do. And if they have special interests, why not point them in that direction and help them work in medications, for instance.